With the pandemic, in the intensive care unit, I took care of critically ill patients. It's an environment of, there's a lot of beeping and heart monitors and everything going off, so you have to try to stay focused on your patient. We had patients who were so ill that we needed not just one nurse to two patients or one nurse to one patient, but 2 or 3 nurses to one patient because they were so ill. And I tried to be a mother hen a little bit to try to protect my teammates from some of the things that we're seeing, but then I said, I don't know, I just feel so noisy and busy and heavy. Thinking I could really use some help today. Claudia was my person.
The year of 2020, the pandemic really opened all of us up to something that we have never experienced. Immediately, we have to implement a restriction for visitors. That means normally a patient would have their support system to be by their bedsides, but because of the restriction, family members or their friends are far away. Our staff are really good at attending to our patients' need. When they can see patient would benefit with empathic listening, they would reach out to me. I actually have a lot more patient visit with patients who claim to be non-religious, but then they realize they also need a human connection beyond just medicine. Someone who can sit with them, just let them talk their hearts, what's weighing them down, what's lifting up their spirit, help them to identify their internal strengths. After all, patients are the ones to decide how their treatment will go, and they are the driving force for the healing power to really come through.
It makes such a difference to me. I learned that having someone to help you spiritually, emotionally, not just physically, the whole holistic part of healthcare just gives a better quality of care.
Loss and grief has been the most prominent theme for our staff because they pour their heart out to take care of the patients. We cheer for those who recover well and get to go home, but we also grieve with the family, with the loved ones. And they need to have a place to share that experience of helplessness and hopelessness so they can release that burden and go back to the unit to take care of other patients.
To give money to the spiritual endowment is really to help the whole state of the hospital and healthcare in general. Really the well-being of people. You'd be giving to people's hearts and their souls.
I don't see myself to be away from my team, whether it is related to patient care or something that affecting their personal life. I am one of them.